More than 71,000 new cases of head and neck cancer will be diagnosed this year, with a mortality rate of more than 16,000. Diagnoses are on the rise, with a 30% increase projected in the next 5 years. Well, here to share the significant factors contributing to these numbers is Dr. Terry Day, Director of Head and Neck Oncology at the Sarah Cannon National Group. Glad to have you with us.
Oh, thanks so much for having me today.
So last month it was Head and Neck Cancer Awareness Month, and to my surprise, read an article right here in the Lowcountry. A beloved figure in our community just revealed that he's cancer-free. So what do you want people to understand about head and neck cancer? Because the numbers aren't encouraging.
Well, yeah, I totally agree, and I think it's really a great opportunity to let people know that the treatment is so much better today and the cure rates have improved significantly. So early diagnosis is key. And what I tell people is if you've got a lump in your neck or a red or white patch in your mouth and it doesn't go away, seek treatment. It's easy to treat, the cure rates are better now, and there's a lot less side effects if you're treated early.
So what is considered head and neck cancer?
Yeah, it's kind of a misleading term because the head encompasses a large area, but it's basically, to simplify, it's mouth, throat, and voice box cancers. So it arises in the lining of the mouth and the throat and the voice box. So it affects things we do every day. And so if you have any sign of something going on that doesn't get better on its own, or a lump in the neck, seek treatment, because we can treat those earlier with surgery or radiation and get rid of them with much less side effects.
So brain cancer, esophageal cancer,
correct,
not considered head and neck
That's
cancers.
exactly correct.
What are the typical causes of head and neck cancers?
Well, it used to be, decades ago, it was smoking and alcohol. And nowadays it's human papillomavirus, or HPV. So thankfully we have a vaccine now that even children can get, and teenagers, and it's even approved into adulthood. So if people get the HPV vaccine, they're much less likely to get these cancers that are on the rise.
And this is also something that actor Michael Douglas was diagnosed with. Now, watching his recovery, maybe you can talk a bit about what recovery does look like when you have to have the surgery, when you have to have these treatments, because for an actor such as himself who speaks for a living, it impaired his speech for quite some time. He's worked through it. I mean, he sounds pretty good now, but it was a road.
Yeah, it definitely is. And so that's why it's such a comprehensive team that's involved behind the scenes. And we talk about it, we separate it into curing the cancer with surgery or radiation or chemotherapy. And then secondly, the quality of life. People want to eat, drink, talk, swallow normally. And so that's why speech therapists and dentists and nutritionists are involved behind the scenes. You don't hear much about them, but they're really vital to the best outcomes for these patients.
Yeah, because I was curious how invasive the surgeries are. And what recovery truly does look like.
Yeah, I mean, I would definitely call it invasive, but the outcomes are what's important. If we can get these people back eating, drinking, talking, smiling, swallowing, breathing normally, then it's well worth the surgery.
And I mean, you were ahead of the game, so you started the Association for Head and Neck Cancer Awareness in 1998.
A long time ago.
A long time ago. I mean, time flies, doesn't it? But that's pretty remarkable, and over 200 publications. So what do you want people to understand? What do you want them to know? And do we see that 30% increase in the next 5 years of global diagnoses?
Yeah, well, as the rates go up, we're also educating more people. And so thankfully for some of our patients and survivors that are getting the word out there, and the Head and Neck Cancer Alliance, people can go to headandneck.org and they can find out places close to them where dentists and physicians are offering screenings or awareness programs. So really, seek evaluation by your dentist or your physician as soon as possible if you're worried about any of these things, and then get treated early. And I think, thinking about the vaccine, the HPV vaccine, and avoiding tobacco products is still very important.
Very interesting. Dr. Terry Day, thank you so much for coming on.
Oh, thanks for having me.
Appreciate it. Thank you.
You.
We'll be back after this.